Today, I'm going to be presenting on athletic injuries and the psychology of injury. So, what is an injury and what might cause an injury? An injury is classified as any type of trauma to the body that results in at least a temporary physical disability and inhibition of motor function. This can also be something permanent as well. Some causes of an injury can be muscle imbalances, high-speed collisions, overtraining, physical fatigue, and physical fatigue. Playing through pain because a coach or someone in place of authority makes them, or because the athlete wants to reach their desired goal. Emotional, behavioral, and psychological problems can also cause injury as well. Stress can also be very big on causing injuries as well. So going into stress, how does stress relate to injury? Higher stress levels lead to an increase in injury. Stress disrupts an athlete's attention by reducing peripheral attention. An increased state of anxiety can also cause distractions and irrelevant thoughts as well. High stress levels can also leave muscles tense, and this interferes with normal coordination and can increase the chance of injury. One of the things that everyone talks about is this idea of act tough and give 100%. Phrases like go home or go hard or go home, no pain, no gain, go for the burn are not great phrases to use towards athletes because it incites the athlete to give 110% no matter what, even if they're experiencing an injury. This can often cause athletes to not recognize the difference between playing hurt and injured, causing an athlete to play while severely injured. Athletes should give 100%, 110%. However, it should not come with undue risks. More is not always better. This can cause overtraining in an athlete. Coaches need to teach their athletes how to recognize when they are hurt and when the athlete is experiencing discomfort. Next topic that we're going to cover is the sport ethic. So sport ethic is when injury increases when a culture narrowly defines success according to win-loss records, values external from success, things like scholarships or prize money, over intrinsic achievement. Athletes should never play through pain and injury, and playing through pain and injury doesn't make you tougher or more valuable to the team. So how might an athlete respond to an injury? The first step is emotional. So they can go through different stages. Stage 1 is going to be denial. Stage 2 is going to be anger. Stage 3 is going to be bargaining. Stage 4 is going to be depression. And stage 5 is going to be acceptance and recognition. So some of the steps within these steps are going to be the first one is going to be injury relevant information processing. This is when an athlete tends to focus on information related to the pain, they're aware of the extent of the injury, and they're going to question how it happened, and they're going to also recognize the consequences. The next step is going to be emotional, arousal, and reactive behavior. This is when the athlete becomes emotionally agitated. They have vacillating emotions, they're emotionally depleted, and they feel isolated and disconnected. The last behavior that they're going to show is the positive outlook and coping. This is when the athlete accepts injury and deals with it. They initiate in positive coping efforts, and they exhibit a good attitude and is optimistic. Most athletes are going to tend to move through these 3 phases. Some athletes might respond to an injury with loss, fear and anxiety, lack of confidence, and they might experience decreases in performance. So how does sport psychology affect injury? The first thing is rehab. Studies show that psychology interventions positively influence injury recovery. They increase recognition that physical healing does not necessarily coincide with psychological readiness to return. Athletes might have anxiety over re-injury, heightened performance anxiety. They might have uncertainty about meeting expectations of others, and they might have concerns about performing not to the level of their pre-injury levels. Adherence to rehab programs is also an issue, and not complying with rehab protocols might show that the athlete might not cope well with the injury. So rehab continued. Psychological factors can greatly affect adherence to treatment protocols. Self-motivation, goal setting, and positive self-talk are just a few examples of how to help athletes adhere to a rehab program. Psychological techniques should be used for enhancing healing and recovery, and not postponing the rehab process any further. So how do we help these athletes? Athletes who live in a high stress life, they have a high trait of anxiety, low psychological and coping skills. They have a low social support, and they have a high avoidance of coping. One way is to build a rapport with the already injured athletes. Building that trust can help athletes through the injury process. Showing empathy towards the athlete. Educate the injured person about the injury and the recovery process, especially when an athlete is experiencing an injury for the first time. Teach specific psychological coping skills. Teach the athlete how to cope when things get hard or they are experiencing setbacks. Help them gain social support throughout the injury. Having a social circle can really greatly impact the athlete's rehab and healing process in a positive direction. So ensuring that athletes are psychologically ready to return to play. So you need to work in conjunction with athletic trainers and medical professionals to make sure the athlete is ready to return to play. Addressing both the physical and psychological factors during the rehab process is key. Make assessments and document the whole process. And then consider factors such as confidence, realistic expectations, motivation, and their fear of re-injury. So that's the end.